You make a point in the book of very clearly discussing that cancer is winnable, and you really want to advocate talking about cure. Do you want to comment about your thoughts on that?
Nowadays, I find that the fellows are not encouraged to use the word cure. So I'm a little of an outlier at Yale. We don't know that you're cured. It's very conservative. It's more like be a little afraid if you encourage them that they're cured and they relapse, then you take the blame for their relapsing. I think patients would rather be free of cancer. They don't want to be told that you're not cured, we can't be sure you're cured. They want to go home and feel comfortable. So I think there's a time almost with every cancer when you know that if they haven't relapsed after treatment, they're not likely to relapse. For example, in Hodgkin's disease, it turns out to be about 4 years. If they go into remission and stay in remission off treatment for 4 years, we're doing the 45-year follow-up of our first group of 188 patients. Those patients are cured. They're alive, free of disease, lived a perfectly normal life. And my feeling is you should say to them, you're cured, and give them the optimism for it. Now, we have very interesting things happening in the cancer field nowadays. The best example I know of is chronic myelocytic leukemia, where we're treating patients. This is disease, when I started out, that was uniformly fatal. We could put patients in remission for a few short period of time, but it was uniformly fatal. Now they take a pill and they live a perfectly normal life. And then when they develop resistance to the pill, pharmaceutical industry has developed 4 others that they can take, and probably will keep doing that. So that you can always find the disease. So they aren't cured. They're just living a perfectly normal life.